Dr. Tiger, continuing our conversation around the stresses that parents and caregivers go through, what would you say to a parent or caregiver who's leaving their primary's office or a pediatrician's office and they've just received a diagnosis for possible autism in their child and they're preparing to take that referral and go seek out a psychiatrist or seek out someone like yourself? What would you say to them as they've probably already gone through and started to kind of look up things online and are kind of feeling that stress and pressure that comes along with that? What would you say to them about what the process that's before them is?
Right. That's something that I run into a lot, Adam, and I'm glad to have an opportunity to talk about this. So yeah, what a stressful, worry filled situation for a parent. And so one thing that I want to emphasize, and hopefully I'll get this across in this video, Adam, is that there's so much that we can do about autism. There's so many therapies and treatments that really allow us to do so much for kids with autism, particularly if we catch it early. And so I'm often emphasizing to parents that hey, this is good that we caught this early because there's just so much we can do. And so I'll be coming back to that, I think, later in our discussion. So the first thing that I think is important to say to parents in this situation is that it is only a possible diagnosis of autism. In the U.S. today, a it's standard that pediatricians and primary care docs for children screen for autism at 18 months and at age 2 years. The probably most typical screener that we use for that is called the MCHAT, which stands for Modified Checklist for Autism in Toddlers. And there are other screeners, but that's the main one nowadays. And as with all screening tests, it's not designed to be a definitive answer to whether that diagnosis, in this case, autism, is going on. And the MCHAT is quite good at screening, quite good at, in other words, catching all of the possible cases of autism. Having said that, it won't catch all cases, but it's very, very good at just about catching all cases. But with a good screener, it can sometimes catch cases that are not autism, that may look like autism, but are not. So the first thing that typically needs to be part of the discussion with the parent in this situation is, what do we do next? And so what we do next is ideally getting that child evaluated by a child psychologist or child psychiatrist who has specialty training in autism. They can be extremely helpful and reliable about definitively answering the question of, is autism going on here? And they also can be extremely important in assembling the right team of professionals that I mentioned earlier that can address can be very helpful in addressing all of the symptoms of autism, can be very important in getting autism better. We'll come back to that. So what is, I think, a big advantage of also seeing a child psychiatrist and child psychologist for this understandably distressed, worried parent who has a lot of questions, is that the child psychiatrist or child psychologist can receive the parent and their worries and stresses and can give reassurance, and most importantly, answer questions and can talk about what we can do about this, talk about all the things that we can do about autism to move it in the right direction with therapies. So that's the preferred path. The other path that has emerged recently recently, I mean in the last 4 years or so, is something called the PADA, Pediatric Autism Diagnostic Aid. That is a software package. It's machine learning, it's artificial intelligence that it's been developed, came out in 2021, I believe, and it has very reliably good concordance, good agreement with experts, with expert child psychologists and child psychiatrists in determining definitively whether autism is present in this child who has been screened to possibly have autism. So it is something that can be concerning to some parents. I'm a parent of 3. I would have caution and some degree of concern about an artificial intelligence determining whether my child has a diagnosis or not. However, I want to say a couple things about that. I'm right there with the parents that have this concern. I share it with you. However, the rates of agreement with expert professionals is very high. It's probably north of 98% in the studies that have looked at it. So there's good reliability here. There's also something I think that's important to mention too, and that is that if the PADA does determine that autism is present, then let's just assume, and I would wonder this as a parent, let's just assume that my child is one of those, say, 2% or so kids who are given the diagnosis of autism by this artificial intelligence, and they actually don't have autism. So what about that scenario? I would want to know. And so here's my answer to that. If the diagnosis of autism is given and the PADA and the MCHAT earlier have both thought that autism may be going on here, the interventions that would follow for autism, the interventions that the pediatrician or other treatment professionals would be recommending to this parent or their child would be, here's my point, would be interventions that are almost certainly going to be helpful anyway, even if the child doesn't have autism. Because if the PADA and the MCHAT have thought that this child may have autism, they almost certainly have symptoms that, although they may not be autism, they are probably symptoms that have very significant deficits in social areas, in communication areas, in areas of rigidity or repetitive behaviors. These are many of the symptoms of autism that I'm mentioning. And although this child, this 2%er child who I'm speaking of here hypothetically, may not have autism, they almost certainly have deficits in these areas that can benefit from the treatments that would follow. And so that's, to me, a reassurance as a parent in involving this PADA software. So why was this PADA software developed? Well, it was developed because of something that probably a lot of parents in this situation that you've mentioned here, Adam, the parent who's just received a diagnosis of autism, a lot of these parents have experienced this situation that I'm about to describe, and that is that we have a real shortage of particularly child psychiatrists, but also child psychologists, especially ones who are trained to an expert level in autism. And so pediatricians and primary care professionals are unfortunately, not uncommonly struggling to get a child who has screened positively. In other words, screened as if it's looking like they may have autism going on from the MCHAT. It's sometimes not uncommon for the for it to be difficult to get the child in to a child psychologist or child psychiatrist. The system is log jammed. We're not making enough child psychiatrists and child psychologists, and this may be something, Adam, that we can talk about in another video. Is why is that happening? And so that's for another day. But the PADA has been a real boon to pediatricians and primary care docs and parents stuck in this situation of not being able to get in to see an expert. You can get a pretty darn reliably expert level answer from the PADA. And here's my emphasis: treatment can move forward. Autism, as folks may know, is a condition where early intervention can be really key, very important. There's so much, and this is where I'll say more of about the topic that I mentioned earlier. There's so much that we can do about autism to diminish its symptoms, to diminish its struggles and impairments over time. And that's particularly reliable when we intervene early. And so the PADA has really helped with that. It can help the pediatrician, primary care doc, and parent begin to assemble the right professionals, the right treatments that help with autism. The speech and language therapist, the occupational therapist, the other professionals who are very reliably helpful with autism. And that's, as you know, Adam, that's another video that we've already done, and we can link that in this video to folks so they can find that video easily. And so the autism treatment team can begin, my point, and it can begin earlier than it would have if that child had to wait to see a professional in the areas of child psychiatry and child psychology. So there's so much that we could talk about here, Adam, but I want to emphasize my main point, and that is that to this stressed, worried parent with a ton of questions who you've described here, and who I have seen many, many times in my career, there's a big reassurance, and that is it's good that we've caught this possibility early on because there's so much that we can do about it. It's not something that is a fixed and movable object that has descended in your family's life upon your child. It is something that we have now in the year 2024, a lot of very reliable therapies that can diminish the struggles of autism, especially over time. So there's a lot of reason to hope here, and we can not only answer this parent's understandable questions, but we can give them a lot of reassurance that there's a whole lot that we can do here, Adam.